There's not necessarily any cause for concern just yet, but we are keeping our eye on a few of the numbers in the Department of Health's latest COVID-19 report. 671 new cases reported today in Arkansas. That's higher than last Thursday, which came in at 428, and the total from 2 Thursdays ago at 517. Active cases are up across the state today as well, but 247. Third day in a row that number has increased. Deaths related to COVID-19 also on a pronounced incline in the state. 22 more Arkansans have died because of the virus. Since November 1st, there have been only 2 days with single-digit increases in COVID-related deaths.
We've talked a lot about long-haul COVID since the pandemic began, but most of the conversations have been centered around adults. Unfortunately, it's happening with kids too.
And that's why Arkansas Children's Hospital is hoping to bring some answers to the many questions that parents have. THV 11's Mercedes McKay explains how they're doing that.
Arkansas Children's received about $25 million to coordinate with 14 other rural states and study long-haul COVID in kids. For parents who have watched their kids struggle with lingering symptoms for months, this research gives them hope.
You get this moment of, okay, maybe we're in the clear, this is gone, everything's good, and it truly has been, every time it has come out of nowhere within, 6 hours of time. She's fine and then she's not fine.
4-year-old Scarlett was diagnosed with COVID-19 at the end of July. It took her about a week to recover, but 4 months later, she's still dealing with the impacts of the disease. Her mom, Lacey Vance, trying to be brave for her daughter when she doesn't have many answers to help.
On the inside, freaking out a little bit because you don't for sure know that this is long-haul COVID. Could it be something else? And so just balancing that level of just being a little bit scared.
Since the beginning of August, Vance has taken off work at least 4 times a month to take care of Scarlett. After weeks of headaches, high fevers, and several trips to the doctor with no prescribed remedies, Vance realized her daughter could still be struggling with COVID-19.
We're just assuming at this point because we don't have another explanation.
But the Vance family isn't in this alone. Thousands of other families across the country are dealing with this, which is why Arkansas Children's is looking for answers.
That's the hope, is that this study is going to help identify ways that we can treat long-haul COVID and improve the symptoms for kids.
Dr. Jessica Snowden says the study will dig into how COVID-19 impacts kids' hearts, livers, and hormones long-term, while trying to figure out why kids are struggling to sleep and focus months after they test positive.
Right now, we don't have any treatment options for that. This study really helps us start to figure out ways that we can help all those families.
While kids like Scarlett still don't feel like themselves all the time, this research could hold the key to brighter days.
The more we can understand about how this is impacting children, the better we can do to get them back on the course that we wanted them to be on in the first place.
In Little Rock, Mercedes McKay, THV 11 News.
All right, so the study hasn't actually started yet, but doctors say children should be able to start enrolling soon.
And once sign up opens, we will have that information for you on our website, thv11.com.